If you suffer from vein disease, you know how uncomfortable and painful that can be. It affects millions of people, and all across the nation, many are turning to the Vein Clinics of America for help.
This is Dr. Scott Buckner.
Hello, Ms. Shepard. How you doing? I love the fact that we're able to change people's lives.
Dr. Scott Buckner is a physician and one of the medical directors at Vein Clinics of America.
It's one of those quality of life things that we can really make a difference, and it's a very prevalent disease throughout the United States.
The disease is vein disease.
Essentially, vein disease is a valvular problem inside the veins. Veins function with a one-way valve that allows blood to go from the feet up toward the heart and lungs and centrally. So if the valve is dysfunctional, then blood is allowed to go in a to and fro manner. That results in a feeling of congestion and discomfort and disease. Smaller veins can't handle that pressure, they become bulgy, and patients will present with heaviness, discomfort, pain, etc. in their legs.
Anyone can get it, but
it's primarily a hereditary thing, but there are certain things that contribute to it, as far as how much you stand at work, if you have relatives that have had it, and if you're obese or have a little bit of, you're a little overweight. So it's really a valvular problem. It's inside the veins.
Dr. Buckner says it's important to listen to your body and watch for symptoms, especially if you're unsure if you have the disease or not.
The vein disease typically feels worse as the day goes on. So toward the end of the day, if your legs feel heavy, lethargic, itchy, burning, or you notice swelling, that sock line where you get swelling at the ankles and feet, it's not typically normal.
Hearing that can be scary, but your next steps don't have to be at all.
One of the nice things about Vein Clinics of America is that we offer initially a free consultation to most insurers, and people are able to come in and speak to a provider and get information. Sometimes we do a quick scan, a quick ultrasound evaluation if necessary. Oftentimes patients' symptoms and getting a good medical history from them, we're able to figure out whether or not they have vein disease, whether or not we need to go on. It's a short visit, probably about an hour, but it's worth the time for someone to get into your history and figure out what's going on and see if we can make a difference. Generally, the process initially involves a consultation, as you mentioned. Once we determine that there is significant vein disease, at that point, we set the patient up for an extensive ultrasound examination. And we essentially map the entire superficial venous system of the lower extremities. And that's the most important portion of the exam, of the initial evaluation, because we want to see where the disease process is taking place. From there, we can plan whether or not we're going to utilize lasers or radiofrequency devices to actually shut down the vein or ablate it, or use ultrasound-guided sclerotherapy with some of the more tortuous branches, and eventually the surface veins. Some patients require all of these treatments, some require portions of it, but we try to tailor it directly to the patient's needs.
And if medical care is deemed necessary, you don't have to worry about popping in from place to place for appointments and treatments.
The nice thing about the Vein Clinics of America is that everything is done within the clinic. It's an outpatient setting, but it's all inclusive. So we can take care of patients from start to finish here. They don't have to worry about going to a hospital environment. Some of our patients come in and on their lunch breaks and have procedures done and go right back to work.
All of your needs are covered because Vein Clinics of America makes it a point to have doctors with varying specialties that complement one another.
That's the beauty of this operation. We have a whole plethora of physicians that are here, all different types of subspecialties, and it's nice because we tap into that. We have some that have a more surgical background, some that have a more medicine background, and we all collaborate to make sure we get the best treatment for our patients. This is what we do, and this is what we love to do. So you really want to pick a provider that has that characteristic, because they're going to do whatever it takes to make sure that things are right, and they're going to be up to date on the latest literature and have state-of-the-art equipment, which is all very important.
Vein Clinics of America has 7 locations, including this one right here in Columbia. For more information, go to veinclinics.com. We'll be right back with more Midday Maryland right after this. Stay tuned.